When you look at a map of Australia, the state of Queensland probably best represents what you imagine the Australian lifestyle is going to be like. And that is where we wanted to build our future and raise a family. The Sunshine Coast looked perfect. We could work in a health district that was moving forward and live in this amazing environment.
With one of the highest number of sunshine days in the world, it's hard not to fall in love with Queensland's Sunshine Coast. Beautiful beaches, coastal foreshores and natural waterways paint the region blue, while thousands of hectares of national parks, hinterland and open space create the perfect green backdrop.
The thing that brought me back to the Sunshine Coast, even from 17 years ago when after I left as a junior, is the fact that I think this community is different.
It's got country, town, beaches, and obviously people are very happy and healthy living here.
To go for a surf after work or just a walk along the beach is a really great thing to mentally relax and unwind. So got the best of both worlds really. It is a gorgeous place to live and work.
I'm 5 minutes out of town. I have acreage, I've got my horses, so I have the best of everything.
What the kids and the family and I like about the coast is proximity. Beach within 10 minutes from home, work within 10 minutes, and a whole lot of opportunities to explore the coast and the region.
There's no limits with the weather. You could just get on your bike and cycle off to your Monday markets. We go up to Noosa. We go just go exploring every weekend.
Malini is a fabulous community. It's very arty. If you're a gourmet food person, it's the best place on the coast to work.
We do a lot of cycling, outdoor sports, surfing. Just went kayaking out onto the Marucci River. We've also been up into the hinterland and spent a nice week at a bed and breakfast up there.
The kids like going on the boat and tubing and fishing. We like to hike on the mountains.
Most people at work are very passionate about their medicine and their nursing as well, but I think they also enjoy having their other interests. And Gympie, I guess, is more horse riding people, outdoors, fishing, camping, boating, directly opposite Fraser Island. So people like their four-wheel driving. They like those days off to be able to do that. And with the way we roster things here, it's quite flexible in terms of lifestyle, so you have that good balance.
What I love, what's not to love? As you can tell, I come from Scotland, so I have probably 20 winter days here a year as opposed to 350 winter days back in Scotland, so it took me a while to get used to not wearing long pants for a long period. It almost, for me, feels like I'm on holiday in Europe.
Mark, like many of our healthcare team, crossed continents to work in the Sunshine Coast Health Service, attracted by the lifestyle and the opportunities that working from 4 hospitals offered. With a laid-back lifestyle and close proximity to Brisbane and international airports, the Sunshine Coast is the second fastest growing regional area in Australia. And over 320,000 residents call this beautiful environment home.
I love coming to work each day. I work with a fantastic team. We've seen new innovations on the unit. We've brought in new nursing practices. There's a whole scope for development, and that's met with a great enthusiasm here.
There's so many opportunities for occupational therapists. You can work across a broad spectrum of services, right from acute into the community.
The junior person coming to an area like this, where it is still small enough to be personable and all departments know each other, allows you to create a network of support for them so that they feel like they're progressing along their careers.
As a psychologist, where I work in the community in mental health, there's a really wide range of opportunities. I work a lot within schools. I get to work in a multidisciplinary team along with other psychologists, social workers and nurses, so it's a great opportunity for me to develop my own discipline but work alongside other disciplines.
We have dental students here throughout the year and they're always interesting to get to know. And there's a good mix of staff that you can get along with.
People are excellent. I lead 35 of probably the best emergency nurses, I believe, in the state, not to mention the medical officers, admin staff and all the other staff that we have as well. Our greatest achievement for this department is we've been nominated for Australasian Emergency Department of the Year. We're also performing within the top 2 emergency departments of the state every month.
We've got some great senior medical doctors and some great senior nursing staff. I started off as an SHO here and I'm now a registrar, and through that time they've helped to provide lots of support, not just in the job but also in the ongoing academic requirements of my profession.
It's something to be very excited about. This whole development of the University Hospital, it's a greenfield development without the closure of any other major hospital. That sets it apart. Most other new hospitals in Australia over the last 10, 20 years have been the redevelopment of an existing hospital or a new hospital built because an existing hospital had passed its use-by date and was being closed. So we're building on top of what we've got now. Nambour, the major referral hospital at the moment, will continue. So this is all about growth, it's all about expanding the range of services, the complexity of services, moving into that full tertiary capacity. Again, to illustrate that, at the moment we operate on about 85% self-sufficiency. That will increase to 95%. So 10,000 people a year that currently go to Brisbane for treatment will receive treatment, we'll have the capacity to treat them on the coast.
The registrars consistently get 4 hours each week of just pure dedicated educational time, but even on the floor there's a great ratio of consultants to junior medical officers, and there's a great hands.
They really support you with education. We have 2 hours of education every day available to us. It's really promoted to increase your knowledge and keep improving your knowledge.
Sharing of ideas is really open and honest, and I think it's crucial to working as a team across all districts so that we can support each other in our ideas and where we're going for the future.
There are ample opportunities for people to develop their own career preferences, whether it be general practice, hospital practice, private practice, or practice with an emphasis on teaching and research.
One of the buzzes I get out of doing what I do is hopefully teaching and sharing some of the things I've learnt through my 30 years in nursing and sharing that with students and people growing into the profession. That's a real buzz.
Those opportunities will increase dramatically as we develop a fully fledged tertiary hospital.
In the next few years, the Sunshine Coast University Hospital is going to provide the Sunshine Coast with a full range of tertiary level services, and that's hugely exciting for a junior person coming here.
It's an opportunity for us to expand our allied health services into areas that we may not have been servicing fully in the past. So I think it's a great addition for the community and will make our jobs so much more satisfying.
Professional opportunities abound with the development of tertiary level services, building on what we've already got. So we'll be enticing for that exciting journey ahead, and where people really do count. We value our staff. We've got some tremendous contributors on staff. We want to attract more people to work with us, and more people of the high quality to match and equal the high quality of the staff we've already got. Well, what we refer to as almost the crowning showpiece of the Sunshine Coast University Hospital will be a centre that's affectionately known as the SARC, the Skills and Academic Research Centre, a unique collaboration between us and 2 universities. So in that partnership, which will have a physical presence on site in a dedicated building, we will have education that will cover all aspects, all streams of our staff, as well as our growing focus on research will be, that'll be the real engine room for driving that further.
Sunshine Coast University Hospital is very exciting. It means that we're going to have the specialty services on our front doorstep, so it's going to improve the patient journey.
Here on the Sunshine Coast, you can mix career and lifestyle, working with people who value your ideas, while living in one of the most desirable places in the world. Come and join us.
I couldn't think of anywhere else that I could live with this lifestyle, have the career that I have, and also be so close to everything else.
I'd like to stay here for the rest of my life, if I can. Queensland fits me as a person and as a doctor as well.
I'd recommend working here on the Sunshine Coast to any allied health professional looking for, career advancement, professional development opportunities and a fantastic lifestyle all rolled into one.
I'm really pleased I made the decision to come out here. It's been a great experience. Looking forward to it continuing because I love it here.
For anyone that wanted to come and work here, I'd say get here now. It's really going places.